So, guys, welcome back again to our discussion of NCLEX, particularly on the most common concepts that you are going to encounter in the NCLEX exam. So, one thing about the NCLEX that you need to understand is that it's no longer being scored with the concepts of it. So, not you're not only going to be scored with management of care, psychosocial integrity, health promotion and maintenance, physiological adaptation. You will now be graded as well with how you perform based on the clinical judgment model of NCLEX. So just like what I said to you on the previous lives that I have done in Facebook, the most important thing to always remember with the clinical judgment is that it defines how nurses are going to think, particularly on a given or a specific situation that is focusing on client care. This is a little bit hard to understand, particularly for our nurses in the international aligned education, nurses from the Philippines, nurses from India, simply because this is not just focused, okay, it's not just focused on you understanding the concept, but how you apply the concept at the same time on how you are thinking through it. So let's say, for example, NCLEX is not going to give you a question wherein, hey, what's going to be the best medication for fever? Instead, it will ask you that the patient has a 100.2 degree Fahrenheit temperature with associated cold and clammy extremities and a dropping BP. Which of your following choices would be your top priority of action for this patient? You see the difference with it? Because in clinical judgment, it is always presumed that a nurse will end up with an effective judgment that will progress the care of the patient. That is how vital we are. Okay, that is how vital we are when it comes to the workforce. Simply because it's not just about you, okay? It's not just about you giving care, it's also you directing the care. So our drill number 5 is now going to focus primarily on select all that apply, that is highlighting the evaluation criteria. So if you've been following our drills activities for the last few weeks, we are going through the levels of clinical judgment and we have already finished analysis, prioritization, application or the interventions that are being given. We also had a discussion when it comes to the trends, when it comes to the NCLEX questions that you could encounter. And now we will be focusing on your prioritization as well as that of your evaluation. So how important is this? How important is this in your NCLEX exam? Just like what I told you, a lot of people failed. Okay, a lot of people failed simply because of this scoring mechanism. Because right now they're also scoring you on how you think. So even though you have studied or memorized everything that is associated with nursing, if you are not, if you are not doing, okay, the effective thinking or applying that knowledge into the effective endpoint of a good clinical judgment, there's a possibility that you will fail in the exam. For the record, I just coached five, okay? I've just coached five people in the last 2 weeks when it comes to them failing NCLEX. And what was the problem? It was not the concept. Some of them are even above the passing level. It was the clinical judgment. People are failing because of the ineffective analysis. People are failing because of the problem associated with proper evaluation of the care of the patient. People are failing because they could not prioritize what would be the next best action. So I prepared for you now 10 select all that apply questions focusing on evaluation, meaning how are you going to see if the care has been effective. Beginning with question number 1, just like what I told you, moving forward, everything is now going to be on the format of NCLEX. Oh, someone told me, yeah, how old am I? Okay, yeah. I'm actually moving 40s for those who are asking, because someone's asking a question. Okay. So let's just share this one. Mhm. So there we go. Okay. Now doing it the review. So for those, I promise I'm going to study how going to do this, and then I'm going to start sharing the screen as well here. Okay. So going back to our Google people. So because for those who are watching this later on, I'm also doing a live with TikTok just for me to, spread the word of our initiative of this free training for nurses and pre-prep for nurses. Okay, we now have question number one. You have a client with heart failure. Okay, you have a client with heart failure that is receiving furosemide as a medication. Which finding should the nurse evaluate as indication that the medication, or indicating that the medication has been effective? Okay, for those who are on TikTok as well, if you're listening to this discussion right now, you have a patient who have furosemide. Which finding should the nurse evaluate as indicating that the medication is effective? Please select all that apply. So the following choices includes decrease in peripheral edema, weight gain of 2 pounds overnight, clear lung sounds, blood pressure drop from 140 to 110 over 70, and finally, dry persistent cough. So what will tell us that furosemide is actually working? So when you're talking about furosemide, you do know that this is a loop diuretic. And a loop diuretic is focusing on increasing the functionality of the loop of Henle in removing water. And why do we do this? Of course, there could be congestion, and it could also be an effective anti-hypertensive medication, literally decreasing the blood pressure. In most cases, if there would be water retention, there would also be a problem when it comes to the quality of your circulation. Therefore, effectively, perfusion is being affected. Nutrition, as well as that of nutrient transfer, becomes compromised. Now, since we've already given this to the patient, let's evaluate. Water is coming out. Essentially, we're flushing out unnecessary water from the patient. What are we going to do, or what are the things that will tell us that it is doing its task? Let's begin with the first choice, decreased in peripheral edema. Would there be a possibility of decrease in the peripheral edema when you're doing this furosemide? Of course. So this is included. So for those who have answered this, for those of my students who are answering this in the free learning group in Facebook, I know that I had you place your answers on the comment box. So you could always revisit that one. But nonetheless, I'm also going to upload this over to YouTube. Now, weight gain of 2 pounds overnight. Again, furosemide releases water. So if you had an increase of 2 pounds, or at least in the Philippines perspective, 1 kilogram, increase of 1 kilogram in weight, focusing on your furosemide use, essentially furosemide is not working. That is actually an indication of water retention. Any form of excessive or increase in the overall weight within the next 24 to 48 hours could be an indication of water retention. So, number two, or letter B, is not included. Clearing of lung sounds, would that be an indication of an effective furosemide use? Yes, it is. Okay. So, any form of fluid congestion would actually go on a third space, which is, of course, your interstitial spaces, the one that is not within the actual circulatory, okay, the circulatory structure of your body, so away from the blood vessel. And the common area wherein water converge is the lungs, the extremities, and sometimes the abdomen. That's why you have your ascites. And in terms of the lungs, that is your pleural effusion. So what will you hear? If there's fluid in the lungs, there could be, what do we have? Crackles, right? We're going to have crackles. So it's not a clear lung sound. So if you have a bronchovesicular, clear lung sounds after taking your furosemide, essentially it only tells you that it is working. So clear lung sounds is something that you could evaluate as an effective impact of your furosemide. Now, a blood pressure that is from 140 over 90 and now going down to 110 over 70. Is that something that is also a good indicator of furosemide functionality or the effectiveness of furosemide? Yes. Okay. Because again, your furosemide is essentially an anti-hypertensive. But this is something again that we are going to use if there would be evidence of plural as well as that of what? Liquid or water retention. Okay. So there we go. How about dry persistent cough? Okay. What do you think about that? Mm-hmm. Is dry cough something? Okay. If there is cough while you are treating furosemide, that could also be a sign of congestion. So again, dry cough or anything that is associated with lung symptoms, shortness of breath, difficulty of breathing. Let's say the patient suddenly develop obstructive sleep apnea or a sudden increase in the demand of oxygen, wherein the patient who is breathing on room air suddenly requires 2 liters of nasal cannula oxygenation. That is an indication again of water buildup. So your letter D, dry persistent cough, is also an incorrect answer. So for all of my students who are already in the group and who answered this and answered letter A, letter C, and letter D, you got it correct. Okay. So again, techniques in SATA, just as a reminder for everyone, when you are dealing with SATA questions, always convert. Okay, convert your choices into a yes and no argument. Same thing and same support that we are other same support same technique that we are using in order to focus on questions in NCLEX. Dissect the question, eliminate the main subject, identify what the question would want to actually ask of you, and then apply your yes and no. Okay? Apply your yes and no evaluation with the choices. So let's apply it with number two. You now have a client with pneumonia that is being discharged on oral antibiotics. So it could be cefuroxime, it could be um, ampicillin, or either way. Now, the thing is, the biggest mistake that most nurses who are going to take NCLEX with this one, the most common mistake that they will have, oh, it's antibiotic. What type of antibiotic? Of course, no, you don't need to think about it. The question is like that. If the question is just saying that it is for oral antibiotic, it's only an oral antibiotic. Don't think too much. What is the antibiotic that was given? Do not question the question. Just answer the question the best that you could. Now, which discharge instructions, based on the question, which discharge instructions should a nurse prioritize to evaluate the client's understanding? So essentially, this question is asking you, okay, which of the following choices are essentially indicators of effective, okay, of effective learning and education understanding of oral antibiotics. Okay, so let's now do this question. Let's begin. First of the choices, again, let's apply it yes or no. Oral antibiotics is your main subject, and then we are being asked which of the following should we evaluate the client to have a good understanding of the medication. I will stop the medications once I feel better. Is it good to stop antibiotics, oral antibiotics, if ever that you feel better? Yes and no. Okay, see in the chat because I'm also running Google Meet. Okay, let's see in the chat. No, of course. The main thing about antibiotic is continuous treatment. You need to make sure that you are going to complete the treatment in order to prevent what? In order to prevent, okay, in order to prevent, thank you very much for the one who answered in Google, resistance. That's the reason why you have a lot of resistance, particularly when it comes to what? When it comes to microorganism. That's why we have the MRSA, methicillin resistant Staphylococcus aureus. And of course, the more dangerous CRE, which is your carbapenem resistant Enterococcus. You also have a little bit worse than that, a VRE, a vancomycin resistant Enterococcus. And where's this coming from? This is coming from the fact that you are not taking antibiotics effectively. So any form of oral antibiotic, okay, we make sure that we take it effectively. So if your patient will be saying, "Hey, I'm feeling good. I'll just stop it." Is that an opportunity for teaching? It is. It is an opportunity for teaching. Okay. I will complete all my doses of antibiotics. The exact opposite. The exact opposite of the first choice. Okay? The exact opposite of the first choice? Yes. Okay. That is included. That is an effective learning for your patient. I will monitor my temperature regularly. Do we need to still be aware of our temperature when we are taking antibiotics? What do you think, guys? Hmm. What does temperature tells us? Okay, so for people in TikTok who are already here and just following and just listening, why do we need to take temperature? What does temperature entails in antibiotic treatment? Very good, everyone. Even in the people in Google Chrome or Google Chrome, Google Meet. Yes, it's an indication of infection. Sudden respiratory signs and symptoms, fever, sudden malaise, or in the case of a patient who is going into sepsis, changes in mentation, right? It all begins with an increase in your temperature. Okay, in an LLE or a national licensure, nursing licensure perspective in the Philippines, anything that is beyond 38, we start at 37.5 degrees Celsius as an indication of what? Low grade fever. Going beyond 38 is already an indication of high grade fever. Okay, in the perspective of NCLEX, because that will be using Fahrenheit, anything above 100 degrees Fahrenheit is an indication of fever. And again, it is telling us there is an infection. So what does that entails with your oral antibiotic? Does it need to be adjusted? Okay. Future nursing students or future nurses who will be working here in the US, UK, or wherever in the world. Yes. The implication of it is we need to revisit. We need to run. Okay. We need to run what? We need to run culture and sensitivity tests. Did the doctor just gave an antibiotic that is not effectively working with the condition? Probably a little bit resistant to it. Or the dose might not be good. So, monitoring of your temperature regularly is an indication that is needed or a good understanding in the use of oral antibiotics. Letter C. I can return to work tomorrow if I feel okay. Or rather, letter D. I can return to work tomorrow if I feel okay. What do you think? So for those nurses there, we're guilty of this, right? Even when we're sick, we still go in and care. That's why our profession is so noble. Imagine you're sick and still you're caring for the sick. Point of the matter is the first 2 days of taking antibiotics, even if you feel better, would still require rest. And one thing to also understand when you are on an antibiotic treatment, there's still a possibility of what? There's still a possibility of what? Communicability. Could you still be communicable? Could you still be infectious in a sense? Yes. Because sometimes it would need at least 3 to 4 days before, okay, before you will be non communicable. Sometimes it would even take a week of continuous treatment. Tuberculosis is a classic example of that. You need to finish at least 2 weeks, 2 straight weeks of antibiotic treatment for your tuberculosis to not become communicable. Okay. So letter D is a wrong answer. It means more education is needed. Then, of course, letter E is the direct opposite of it. I should rest and increase fluid intake. Yes, that is a good indication of effective education about oral antibiotic. Okay. Why? Because most oral antibiotic are being excreted through the kidneys. Very good. Because the kidneys would then eventually lead to what? What is that toxicity? Nephrotoxicity. Okay? So again, in the question of a pneumonia client receiving an oral antibiotic, which of the following is an indication of a client's understanding? That will include completing the dose of the antibiotic as prescribed, monitoring temperature or any form of vital signs changes, and finally, resting and making sure that you are non communicable before you once again go out in the world. Okay. Okay. So, guys, so for the people on Google who was like, "Why am I looking left and right?" Yeah, I tried to extend our classes on the TikTok live. Unfortunately, I'm a little bit too old to understand technology and I cannot connect it. I cannot share the screen. But nonetheless, guys, okay, just share the word if you have it out there for those people who will be watching this later on in our group. Share the word that we are still having that continuous free education as well as free preparation for your nursing examination. Okay, you don't need to spend too much. Okay, that's was my mission ever since way back 2013, because not everyone could afford a $500 UWorld subscription. Okay, let's now go to the third question. We are now evaluating the effectiveness this time of a diabetic teaching in a client with a newly diagnosed type 2 diabetes mellitus. Now, which of the following statement reflects an understanding? Okay, so again, diabetic teaching is our main subject. Okay, what should be? Okay, what should be, or select all that apply, which would be an indication of us, okay, of our patient having a good understanding of this condition. Okay, let me try to let me try to do it like this. I'm not sure if this would work. Mhm. Okay. Mhm. Oh, there we go. That's a lot better. Okay. I don't have a stand. That's the only thing. So for those guys, okay. I think I need to create a better setup on my live streams moving forward because that would be helpful for you guys. Anyways, let's do it next time. Now, let's continue on. Beginning with letter A. Would it be necessary for a person who just been diagnosed with type 2 diabetes mellitus to check, the patient is saying, I would check my blood sugar before meals and bedtime? Is it necessary? Is it a good understanding of the condition? Yes, it is. Letter A is a correct answer. I need to skip meals to keep my sugar low. Like you force intermittent fasting in your system simply because you have diabetes mellitus type 2. Is that good? Okay. Of course, it is. Okay. It is. Are you sure? Yes. Very good, Lou. Okay. If there is a need for you to do fasting blood glucose, that's the only time it would be effective for you to have fasting. What's the problem when we are fasting? What's the problem when we are fasting? When we deprive our body of effective nutrients, we are going to be triggering. We're going to trigger. We're going to trigger what? Glyconeogenesis. So essentially, you're creating, and your body will be converting proteins into glucose. And now you're going to have another problem. That would create, okay, that would create a higher, because the problem is you have insulin sensitivities, okay? You have not insulin sensitivity, but rather insulin resistance. And then you're going to add sugar to it. You're going to add glucose to it. Simply putting it, to make it easier for everyone, you're just adding, okay, and adding unnecessary glucose when it's supposed to be being supported by insulin already. So skipping meals, okay, skipping meals is not the best way to do. In fact, what do you need to do when you have diabetes mellitus? Do we skip meals? We do small, frequent feeding, right? And then we are going to lessen, right? We're going to lessen carbohydrates, and then we are going to actually increase protein intake. So that's how we're going to approach the diet. You're not going to, hey, I'm going to stop. Okay. I'm going to stop whatever that is that I'm doing. Okay. I'm going to stop whatever it is that I'm doing at the moment. And then, I'm not going to eat. I'm going to starve myself, because I think that would be a better option for most. Of course not. It's not going to be like that. And the biggest problem that you're going to have afterwards is that your sugar could be a little bit increased. So, letter B is not a correct answer. I will carry glucose tablet in case of hypoglycemia. Especially when you're taking insulin, the biggest concern you're going to have is none other than hypoglycemia. So, letter C is a good understanding of diabetic education. If I feel dizzy, this is letter D. If I feel dizzy and shaky, I need to eat something with sugar. Okay? Tremors, cold sweats, the feeling of nausea and vomiting, as well as that of what? Vision changes, is the classic signs and symptoms of hypoglycemia, right? So we needed to supplement. That's why we need to have them what? Carry candies around, right? We need to carry candies around, especially for people who would be taking glargine, right? Because glargine doesn't have the risk of hypoglycemia when it comes to long-acting insulins may be a little bit lower. But if they're also taking, let's say, Lispro, Aspart, Humulin R, right? There's that risk for hypoglycemia. So letter D, which is making sure that you have an effective source of sugar, is also a correct answer. I only need insulin when I'm sick. And you just feel it. Is it good? Mm-hmm. Well, you're more than welcome. Just share our initiative. This is a way for us to help you nurses to actually go. Thank you for everyone who's like telling me doing this. This is just a way of me giving back to a profession that has been very generous in my career as well. So yeah, thank you guys. Okay, now let's see. You only need insulin when you're sick. You only need insulin when you have hyperglycemic state. Okay? Would we need? No. Is it good? No. You need to take it as prescribed. Okay? One of the biggest thing that will create more insulin resistance is that if you skip your insulin dose. And that will be again a possible restart of your treatment essentially. Very good. Insulin is prescribed for the purpose of your glucose to actually be absorbed by your by your cells. Unfortunately, in diabetes mellitus type 2, your insulin is no longer enough because there is that insulin resistance. Now the cells becomes a little bit more less sensitive with insulin and doesn't accept sugar. And where does all this sugar, and blood glucose goes to? In your bloodstream. And what does it makes? Okay? Glucose is a glucose is a what? Glucose is a heavy molecule for the blood. It makes the blood thicker. That's why all of your diabetes signs and symptoms, especially advanced signs and symptoms, would include what? PBDs, right? Clogging of the heart, atherosclerosis, stroke, neuropathies, primarily on the eyes. Okay, kidney damage, particularly on the tubules. That's why you will have chronic kidney diseases. The biggest concern when you have with diabetes mellitus is end-stage renal diseases. Because sugar is no longer inside the cell. It's just running around the blood, making it thicker. And problems will occur. So letter E is an incorrect answer. So the correct answer for this one is A, C, and D. Checking your blood sugar regularly, carrying a glucose tablet or a candy, something that would be an immediate source of sugar. And then if you feel dizzy, make sure that you have something to eat in order to prevent a hypoglycemic state. Okay, let's now go to question number 4. You are now a nurse caring for a client who just had thyroidectomy. Which assessment finding should the nurse evaluate as needing an immediate provider notification? Select all that apply. So if it is a provider notification, it only means that the patient will have complications. So what are the things that we needed to watch out for here? Okay. Tingling around the mouth and the fingers. Okay. There's like tingling. Mhm. So what happens when you have thyroidectomy? Let's see. Let me see if anyone would be able to answer me on this um on this discussion. I'm just going to the uh what happens when you have thyroidectomy? Yeah, we remove the thyroid. Hmm. So what do we have? When you have thyroidectomy, you actually you remove the thyroid because guess what? There could be an overgrowth of it. Simple as that. Metabolism is decreased. Yeah, there's a removal of thyroid. But what happens is, why? What happens is with this? Mm-hmm. Afterwards, your biggest concern is what? Hypo, hypocalcemia. Okay? Because why? Your thyroid, simply putting it, just to make it easier for everyone, will what? Mm-hmm. Will what? So calcium is not going to be absorbed. As simple as that. Now you have a decrease in the overall calcium that is needed in your body. So what would happen? Essentially, this would lead to side effects of hypocalcemia. So what are those side effects, or rather what are those effects that you could see? That there's very much decrease in calcium. There is very good tetany as well as vascular excitability, right? So there would be what? There would be neuropathies that you could feel, right? There could be a possibility of hoarseness in the voice as well, because this is a full surgery. Okay? So, A, tingling around the mouth and the fingers. Indications of neuropathy? Yes. Okay? Hoarseness that is worsening. If you had a surgery in the throat and there is a sudden hoarseness of the voice, that is an indication of inflammation of the area. Okay, so there could be fluid accumulation. So what are we going to do? Elevate it to the provider, because hoarseness of the voice or the problem with hoarseness is that it is an inflammatory reaction. Okay, it's an inflammatory reaction that could cause closure. Okay, closure of your airways. Okay, so if there is a sore throat when you're swallowing, is it expected that it's painful when you swallow post thyroidectomy surgery? Yes. Okay, so that is not included. Why? We report only, okay? We report only possible complications to the provider. Any form of expected, okay? Any form of expected signs and symptoms is non-reportable. And everyone on TikTok was saying, okay, chopsticks, okay, Vostok sign. Yes, that is also, okay, an indication. That's already what? Tetany. Okay. Now, with the hoarseness of breath, this is the last one, respiratory stridor. There is that, you see? hmm You see, there's that what? There's that presence of something that's blocking the throat. There would be a sound like, okay, when you are breathing, that is your stridor. Meaning there is something that is obstructing the main tracheal area. And where's your thyroid? Where's your thyroid again? Your thyroid is here. Like seriously. Okay, the thyroid and the parathyroid gland is at the front of the trachea. So any form of inflammatory reaction there, meaning there's a swelling secondary to post-surgical interventions, is a concern. So respiratory stridor is also a reportable condition. So again, any form of neuropathy, indication of tetany, hoarseness of voice that is worsening, positive Bostic sign, and respiratory stridor are the things that you need to report to your provider. Okay. Mhm. So I have a question here. Is it okay for us to just answer Q banks, especially if the exam is already near? Yes. Do not try, because the problem with preparations in exams, and this is something that I would also like to share for people who would be doing NCLEX, especially in the perspective of NCLEX, because NCLEX is something that you could take almost any time, as long as there is an opening when it comes to Pearson's testing center. One thing that I would want to emphasize with you guys is this: make sure that you don't overwhelm yourself when it comes to studying. Yeah, it's good that you read, it's good that you, but the thing is, look at it this way. When you are reviewing, especially if you are with a review center, or let's say, for example, you will be having multiple question banks, the way I describe or the way I explain one thing may be the same, okay? May be the same with the others, but in more cases than not, it's different from another person. Even if I'm going to give a full-blown discussion of stroke at the moment, or warfarin, because that's our next question. Okay, what would be our warfarin therapy treatment? Okay, so one thing that I would want to emphasize there is this: what, how, or rather, how I actually explain it might be different to another reviewer, to another resource, to another literature. I'm explaining it in a way that it's easier for everyone, okay, to understand. At the same time, on the others, it could be, they want to have a comprehensive discussion of it. So what's wrong with that, sir? If you will do, let's say in 1 week before your exam, if you will do U World, Archer, Lippincott, Saunders, all at the same time, you're not studying, you're cramming. You're putting too much information in a different perspective in a very limited time to your brain. And what does it do? It makes you incapable of answering and understanding the concept correctly because you're stressing your brain out. You're stressing your brain out. And that's not healthy in any form of exam preparation. So, for all of my students here right now in the Google Meet and everyone there on TikTok, when you study, make sure there is a structure to it. You just don't memorize. You need to understand, you need to retain. Okay? But more on that on a different day. Let's continue on with our evaluation. Hopefully that will help you see the perspective in the preparation. Now the question is warfarin therapy. And when we're talking about warfarin, we're talking about anticoagulation. So essentially, when there's anticoagulation, there's bleeding. Simple as that. So if there is bleeding, what am I going to do? So the client statements, okay? So this is how the question goes for anyone who is on TikTok. A nurse evaluates the understanding of a client on warfarin therapy. Which statement of the client would require a follow-up teaching? What do we need? Okay? What do we need to address? So we are looking for, okay, for my nurses here who have been with me for quite some time, when you see this, this is a negative statement question. So we are looking for opportunities of health education. Let's do it. Letter A. I will use an electric razor when I am shaving. Would it be good? Would it be good to use electric razor? Yes. Okay. We are not going to use manual blade razors because that is prone to bleeding. Electric razors are a little bit safer. Okay, it's more safer and that is actually advisable. So is it a negative statement in a select all that apply? No, it's not. So that is eliminated. I can take ibuprofen for a headache. Ibuprofen. Okay? What do you think? Mm-hmm. This would require follow-up teaching. Okay? Yes, this is now the thing. This is one of the things that would require follow-up teaching. What is your ibuprofen? Your ibuprofen is a non-steroidal anti-inflammatory analgesic. An NSAID. We need to follow it up. What does NSAID do? NSAID? NSAID creates? NSAID creates?
There's no incoming call.
What's wrong with this? My Alexa is working on its own. NSAID is a problematic item with warfarin because it creates platelet degradation. Right? Your NSAID has some antiplatelet properties. So this would actually lead to bleeding. Okay? I will eat leafy greens in consistent amount. Okay? Will we add that? Would you need that as a follow-up teaching? Hmm. Not in excessive, but in consistent amount. Yes. No. A lot of people. Are like, okay. So eating leafy greens in consistent amount is a good indicator of learning. You don't need excessive greens because, of course, green leafy vegetable is good and heavy with vitamin K. And what does vitamin K do? It's your main antidote to warfarin. So it works against warfarin. So you need to still have a consistent amount, but you're not going to have excessive amount. So again, the thing with pharmacology, you do not compromise effective diet. Okay? It doesn't mean that, oh, vitamin K is going against warfarin. I'm not gonna eat vegetables anymore. Of course, you still maintain. Yes, just consistent. Very good. Very good, Snersha. So you need to, that is an incorrect, okay? That's an incorrect choice because that is an indication of understanding. I will notify the dentist. I will notify my dentist for this medication. Warfarin is a long-term medication for some, okay? Take note, particularly if the patient would have, especially if the patient would have transient ischemic strokes, problem um, when it comes to atrial fibrillation, because that would create your unnecessary buildup of clots as well. So, would it be necessary that we notify your dentist? Yes. Okay, because dental surgeries are one of the most common surgeries that could trigger excessive bleeding complications. So, your dentist should know that. I will report any blood on my stool, bleeding in the stool. May it be black tarry stool, which is an indication of upper GI bleeding, or red. Is it a good statement as well? Yes, it is a good statement because that's an indication of the patient's knowledge and understanding of the risk associated with warfarin. Sir, select all that apply, and the only correct answer is B. Is it true, sir? Because a lot of a lot of instructors are telling us that it should be at least two. No. Okay? In the latest changes when it comes to NCLEX, actually this was applied way back 2018. Yours truly had been teaching NCLEX since way back 2013. So I've seen the 2015 iteration, the 2018 iteration, the 2022 and the 2023, which is now the NGN iteration of NCLEX. So what does this tells us? In the 2018 test plan, the select all that apply became one or all. Okay? One or all. Oh, someone is asking when is this is the first time I went live on TikTok, and thank you very much. Oh, 3,000, almost 3,000 likes. Thank you. But I'll try to make it a consistent one because I'm living in the US at the moment. So there's like a very huge time difference. But nonetheless, more likely like around this time, for you guys there in the Philippines, by if I don't have a class, more likely 8 o'clock in the morning there up until like 12 noon. We'll make it consistent. Okay? So share the word. Yes, I'll study more on how TikTok, because literally TikTok's eating me alive. I don't know how to if this is a regular Google Meet setup, go to meetings, Zoom meetings, it's easy for me to stream. But yeah, I need to study the structure. But nonetheless, next time I will make sure that people in TikTok will be seeing the screen. I'll try my best if I need to rotate my my phone. Okay. Okay. Now, let's go to the last five question. Question number six. A nurse is evaluating now infection control practices during a central line dressing change. Okay, by a new nurse. Which observed actions, again, requires intervention. So from a negative statement, we are now looking into a negative action. Okay, we're looking at a negative action question. So which is not within. Okay, so one of the biggest things when you have central lines, PIC lines, CVC, central venous catheters, or if you have like permanent lines, okay, as well as hemodialysis, um, fistulas, is that it is exposing the direct bloodstream. Okay, so that is what you call a central line associated bloodstream infection, otherwise known as your Club C. So for nurses, for my nursing students here who are in the US, who is joining the class right now, Club C is one of the most important measure of nosocomial infection that is being checked by the JCI. Yes, it is your primary prerogative as a nurse, especially if you're practicing here in the United States, to make sure that that is not going to be a common thing. Okay, if that would be a common thing, your unit will be up for audit. Like seriously, your unit will be in a big trouble if you're having Club C almost every week. This is something that, to be honest, on my unit, I'm a little bit proud of because we didn't have a Club C for like 2 years now. I'm really proud of my unit because of that. We're keeping up. We're keeping up with it because essentially, why? The problem with Club C is that it could create septicemia in a quick manner. Let's not do fancy pathophysiology. I'm not here for it. I'm just here for you guys to learn. If you have a bacteria running in your blood, especially on the bloodstream, the risk of it creating sepsis is too high. It could create a local infection in the heart, therefore creating endocarditis, which is the very first one that would happen to the patient because most of these lines are essentially located to the, okay, it's either in the vena cava, superior vena cava, if it's running from the arm, or sometimes it's anchored on the right atrium itself. So any form of infection that you introduce in that line would essentially settle in the heart, and you don't want that. And that's the reason why Club C is like a very high target, high priority nosocomial infection. Okay, so now let's go. This question is now, which requires an intervention? So again, a negative action question. If we're going to use sterile gloves, drugs, sterile gloves during dressing changes, is it good? Is it a standard one? It is a standard one. Therefore, it's not a negative action. We eliminate it. Wearing masks during a procedure. Yes, that is also a good action. Therefore, we eliminate it. In fact, just to give you a little bit of a heads up, guys, I'm not sure if it's being done there in the Philippines, but uh, if we are changing our lines here, more likely we are doing it in a sterile procedure. So it requires two nurses. Both of us are actually with a mask and even a headgear, and then we change it in a sterile procedure. So wearing a mask is a good one. Touching sterile supplies with clean gloves. Problem? Is it a problem? Hmm. You see, that is a problem. You never touch sterile with clean. Sterile goes with sterile. Okay? Sterile goes with sterile. Always remember that. Basic aseptic principle. Cleaning the site in a circular motion, center towards outward. Standard? Standard procedure. So we eliminate this one. Allowing the antiseptic to dry before you apply any form of sterile dressing? Yes. So again, here we go. Only one correct answer. The one that you would want to prevent is to actually touching your sterile equipment with clean gloves. Essentially, we are actually infiltrating the entire setup and we need to open up another one. Any form of sterile field that is compromised is no longer good. Okay. Let's go to question 7. A client with a recent stroke is being evaluated for discharge. Now we have a stroke patient that's about to be discharged. Which action by the nurse ensures a safe transition to home care? So let's do. Assessing the ability to swallow before giving oral meds. Is that necessary for any form of stroke patient? The Yale bedside swallow test? Yes, it is. So that is a correct answer. Ordering a home safety evaluation with or through a home occupational therapies. Okay, home-based occupational therapy. Is it necessary? Yes. For people with stroke, especially here in the US, it is a requirement that there would be consistency and continuity of care. So I'm just telling it, especially for those international students who will be taking NCLEX later on, you need to make sure that you also think of it in a way wherein it is based on a US healthcare perspective. There is full continuity of care. Okay? So we have full continuity of care. So recommending the client drive short distances only. Driving post stroke, is it good? Of course not. So eliminate that one. Letter C is an incorrect answer. So anything that is neurological in nature that creates deficit when it comes to cognitive abilities, reflexes, strength, as well as overall coordination of the body, that is out of the question. You do not allow them to do it because that is a big risk for life. Providing caregiver education, especially on mobility assistance, moving the patients. Is it necessary? It is. So that's also another one. Referring to physical and occupational therapy, just like what I said a while ago, there should be continuous therapy treatment. Okay, so for my students who are on Facebook, if you were able to answer letter A, B, D, and E, you got it correctly. Okay. Let's now go to question number 8. A nurse is caring for a client receiving morphine by a patient controlled analgesia or a PCA pump. Which finding indicate the nurse must take immediate action? Which of the finding indicates that the nurse must take an immediate action? Let's do it. Respiratory rate of 8 breaths per minute. Is 8 breaths per minute already an indication of a problem? Yes, this is already respiratory depression. Changes in the consciousness that results with the client being unable to arise or high or rather low arousability. A problem? Yes. This is also an indication of a problem. Every form of changes in dementation means decrease in oxygen in the brain. Therefore, we need to do something about it. Sedation. Sedation score of 3 in a scale of 0 to 3. Okay. In a sedation score, okay, non-responsive to pain, non-responsive to voice, non-responsive to vigorous stimulation. Yes. Okay, that's an indication of full sedation or possible coma associated with overdose. Pain rating of 7 to 10. Okay, is that something that we need an immediate action? No. Okay, why? Because sometimes people are just indicating that there is pain, but in fact, they could be addicted to it. That's the reason why PCA pumps exist. Sometimes it has a placebo action wherein they're like pressing it to believing that they are being given a medication, but it's actually controlled doses. So for those who haven't seen a PCA yet, especially for the students, a PCA pump is actually calibrated with either a number of clicks or a number of administration or limited by a number of dose, specific only to the body weight of the patient. In some cases, I preferred personally the control on the pressing. So sometimes in an hour, they could only do 6 or 4 cycles of it. That's the only thing that they could do. Because that would allow you to actually control the administration of the medication. So sometimes some people who are addicted with opiates would continually say, hey, I still need this and that. I'm still in pain. Okay. A PCA pump is a continuous analgesia administration equipment. So it is being controlled by the patient, and usually you could see this for patients who have terminal illnesses. Cancer is a classic example of that. Or if there would be, let's say, for example, severe spinal stenosis and problems. Okay, so there you go. That's the PCA pump. A decrease in your SpO2 to 89 on room air. Any form of decrease in oxygen saturation is also an indication of a decrease in respiratory drive. Therefore, letter E is also included. So if you answered for my students in Google Meet as well as that of the Facebook group, if you answered A, B, C, and E, you got it right. Last two question. We are now evaluating a client's ability to self-administer insulin. Again, self-administration of insulin. Which behaviors indicate readiness for independent management? Meaning the patient can now do it on his own. Letter A, correctly draws up the insulin dose. Correct dosage of insulin, okay, is an indication of a positive statement. Very good, Nersha. So that is included. The patient is stating that he needs to rotate the injection sites. Is it a positive statement as well? Yes. Okay. Asking the spouse or the significant other to do the insulin administration themselves. Okay, that is dependency. Now, what is the problem with this? Sometimes we do not value dependency or we do not give too much emphasis on dependency because there's a possibility that the patient or rather the person who is giving it might not be able to have a good understanding of the treatment. So could there be a possibility of overdosage? Yes, there's a possibility of overdosage. Would there be a possibility that the patient will have a problem primarily when it comes to the actual administration of it? Yes, that's another problem. So letter C is incorrect. Identifies the sign of both hypo and hyperglycemia. Yes, that is a correct statement. Perform blood glucose checks accurately. They need to perform blood glucose checks accurately? Yes. So if you answered A, B, D, and E, you got it correctly. Last question, select all that apply. A client with COPD is prescribed a home oxygen treatment. Home oxygen treatment. So, very common here in the United States that they will have a DME. What that's we call a durable medical equipment, and they will be supplied their own oxygen tank at home. Yes, it's refillable. Unlike in the Philippines where you need to buy, the entire system, here it is covered by their insurance. Now we have someone who has a home oxygen. We evaluate them, okay, and which of the following is showing or demonstrating safe use of oxygen at home, okay? Oxygen at home. I will keep the tank away from any open flames. Is that good? It is good. I can apply petroleum jelly to keep my nose from drying. Is it good? Okay, those are actually incorrect. Okay, some people believe that placing moisturizer there is good. No, it's just going to cause maceration. That's why you also have pressure injuries associated with lines, particularly nasal cannula. And I've seen it when it comes to long-term elderly people. Well, then they will have wounds here, wounds at the back of the ear. There would also be like pressure sores here. Because why? Because they're placing, okay, petroleum jelly, and petroleum jelly also creates heat. What's the best way for us to ensure that there is continuous moisturization when it comes to taking or using oxygen? We need to attach it to a water source, right? We have the what? It's not just directly from the oxygen line. There should be a water cannula there, or rather, there should be not a water cannula, but an actual. Okay, you need to have that sterile water that is where your oxygen is running through to make sure that there is what? What do you call that? It's a humidifier. Yes, there should be humidified H2O together with your oxygen. Okay, to make sure that it will relieve unnecessary dryness of the nose all the way to the upper respiratory tract. I should not smoke while using the oxygen, of course. Anything that has a flame could create problems. I will store the tank upright and secured. That is also a best practice. I will adjust the oxygen flow based on how I feel. Is it good? Of course not. Letter D, or rather letter E, is an incorrect answer. Okay? Why is it incorrect? Because even oxygen is prescribed, especially when you have COPD. You do not want unnecessary adjustment or increase in your oxygen supply or oxygen introduction because that will create a depletion of your, thank you very much from the Google team, decrease in the hypoxic drive. And the next thing you know, your diaphragm would stop working. There would be respiratory arrest. Okay. Thank you very much. So that is our select all that apply discussion. I will add more to this. There will be more, and that is a pure promise for everyone, especially with my students. So for those who haven't followed the YouTube yet, as well as the Facebook, for those people who've just seen me here bouncing through the live and found me, check my bio. There is the link for our Facebook group. For our study group, I've already placed free modules there in preparation for the NCLEX. If you need books, as well as that of study materials. As always, your coach is always open. Feel free to DM me, TikTok, Facebook, you know where to reach me, and I'll be happy to share my preparation materials with you. Yes, books, actual books that you could use. So it's now 12 o'clock there in the Philippines, 10 evening here in the US, particularly in my time, 12 in the Eastern time. So people who had been joining me from the Eastern Seaboard, thank you very much. Hope you have learned a lot when it comes to this learning session. I'll try for the people in TikTok. I feel this is a little bit more engaging, so I'll try to have more regular lives. Hopefully, I just need to set up whatever I needed to set up in order for you to also be indulged as well as included in the actual question and answer. So just a parting message, okay? Be the best nurse out there. You have the most noble profession simply because you are giving life a second chance. So see you again, guys, in our next live. This is your coach. Thank you very much for joining with me. Be safe out there, especially for people in the Philippines. I know, delikado ngayon. Be safe wherever you are. Bye, guys.